Well, contact investigation, once we get the positive result back, we then call the person back and we discuss more specifically who their contacts are. So we will have them get out a calendar, a scheduler, something, and once we nail down the date that their symptoms started, then we will walk day by day, hour by hour if needed, through their days and identifying who their close contacts are. And then we make a list of them. We have to gather contact information for each of those people. And then one of us or the other nurses in our department will call them and notify the people that we determine are close contacts that they have an exposure, and we'll go from there.
They will identify, well, I have a spouse or children. Okay, we start from there. And I work in an office, and we've not been really practicing our social distance, because we all think we're all well. And we let them know that when we contact these folks on their behalf, we do not identify who they are, and we request that they not tell them either, because we're just saying, we're calling you to let you know you've been exposed, and we'd like to give you some guidance and direction with that information.
And what we do is we gather their contact information and call them by phone, and we have a form that we have in front of us to help us to gather the data that we need from each contact. We ask them for their demographics, and we ask them whether they're having symptoms right now, because that's an important thing. When we contact people that are close contact, they may not be well. They may have started coughing. They may not know the person or know that someone was sick. So that's one of the first things we ask is, are you well, or are you having some signs of illness? And so if they're well, they will be contacted daily. We'll call them on the phone. We'll arrange with them, what phone number they want us to use, cell phones, landlines, and we will contact them daily for 14 days after their exposure.
We will call you as soon as we get those results. We will not let you wait. As soon as we get them, we have a group of people who will be making those calls and letting you know, here's the test result. And please continue your social distancing, continue the cleaning, the hand washing, and keep yourself safe.
We generally try to get it done within the same day. We start as soon as the results come back. Sometimes it spills over into the next day, depending how extensive it is, how difficult it is to get the information on who the contacts are.